YouTube channel after we're done. We'll also send the link to the recording and all our presentations to everyone who registered. So now I'd like to turn our attention to today's speaker. Helena Fox, who's joining us, has a master's in science in gerontology. She's an Aware and Care ambassador for the National Parkinson's Foundation. Aware and Care ambassadors are trained volunteers who provide education and resources to families, providers, and hospitals about living well with Parkinson's. She's also a hospital care lead for the Parkinson's Foundation. And today she's here in this role as a hospital care lead to share her all the wonderful information about the new guide, hospital guide. Her professional experience includes nonprofit program management and direct services for adult day programs, serving clients with Alzheimer's, stroke, and Parkinson's. She currently serves on the board of directors of the Santa Cruz Parkinson's group called EASE PD. And in addition, Helena has a personal connection to Parkinson's, as her sister and brother-in-law have both been diagnosed with Parkinson's. So Helena, thank you so much for joining us today. I'm really pleased that you're able to make it. I will go ahead and share the slides, and then you can get started with your own introduction and the slides. Give me 1 second, okay?
Okay. Can everybody hear me okay?
Yeah.
Yes? Okay, great. Well, thank you so much, Monique and Todd and Jen, for inviting me. It's always a pleasure to be here and to share different information from the Parkinson's Foundation to all of our fellow care partners and our Parkinson's community. And I'm here today on behalf of the Parkinson's Foundation. And have any of you contacted the Parkinson's Foundation for anything in the past? Anybody for anything? We have a wonderful thank you, Karen. Yeah, we have a hotline that you can call for questions. We have lots of information, webinars, so it's really a great service for all of us. So as Monique had mentioned, we at the Parkinson's Foundation have a new hospital safety guide, and it's all about staying safe in the hospital, because none of us want to go into the hospital, but sometimes these things happen and we want to be prepared. And this guide is going to help you to advocate for yourself when you're in the hospital and to stay safe. Next slide, please.
Okay, give me 1 second.
No problem.
Oh, okay.
So this is my sister and myself. So I just wanted to tell you a little bit about my background and why I got involved with the Parkinson's Foundation and EASE PD and working in the Parkinson's arena. My sister was early diagnosed with Parkinson's, actually before she was 50. And she lives in Lansing, Michigan now. Recently, several months ago, she was in the emergency room. She had a severe side effect from a motion sickness medication that was prescribed for her, and it was a contraindicated medication. What happened, she was on a train trip coming out here actually to see me, and they had to remove her from the train by ambulance and take her to the emergency room in Roseville. And when she got there, she didn't have her medications in the original bottles. She had her pill pack, but not her medications in the original bottles. And she did not have a bracelet on that identified her as a person with Parkinson's. And she didn't have her cell phone. Okay, so for those of you that think, oh, as long as I have all my information in my cell phone, I'll be okay. Well, as long as you have your cell phone and if your cell phone is charged. So she had a real hard time until I got there. And once I did get on the scene, we were able to get her medications, not from her pill pack though. I mean, it came from the hospital formulary. And fortunately, they did have the carbidopa that, that she was prescribed. So I really understand the importance of preparing for a hospital visit. Now, before we go to the next slide, I want to tell you that I've been thinking a lot about talking to you today and how I can go ahead and explain all the information that's in the new hospital safety guide, because there's a lot there. But I want to ask you a question. Are any of you out there getting this magazine, Brain and Life?
No.
No, nobody? Well, I'm going to tell you, if I had just looked at this like a couple days ago, actually, when it came. That's a free magazine. It's so good because there's always articles in here about neurological disorders, Parkinson's, Alzheimer's. But I want to go ahead and read this little part here about safety first. And it talks about what we're going to talk about today, about hospital safety. And it talks about anticipating medication changes. So whenever people go into the hospital, it's talking about to identify patients with Parkinson's disease when they enter the hospital. What we've done, the Parkinson's Foundation, we've partnered with Epic. Epic is a medical records company that what we're able to do now in many hospitals and centers of excellence, we're able to flag people coming in that have Parkinson's. Now, this is not across the board, but in some cases, people can be flagged when they do enter the hospital, which is a big deal, and it will help a lot of people and protect them from getting the wrong medications. Also, it talks about this hospital safety guide, and it's going to help the families to prepare, help people with Parkinson's and families to prepare for visits in the hospital. So this magazine is free, Brain and Life, and I think that Jen will be able to put it, if you can, Jen, in the chat for everybody to go ahead. You could get it digitally or you can get it in the mail, hard copy. So next slide, please. So I want to talk about the risks about going into the hospital. So if you think about people with Parkinson's, if you just imagine 12 people with Parkinson's, and that's not hard for us to do. I mean, there's probably 24 of us here today. So 12 people with Parkinson's. So this year alone, all right, 12 people with Parkinson's, 4 of those people are going to have a hospital visit. Next slide, please. And out of those 4, 3 are not going to get the right medications on time every time. Next slide, please. And of those 3, 2 people are going to have some type of complications as a result when they're in the hospital. Complications like possibly not as successful an outcome, maybe a longer hospital stay. And unfortunately, people with Parkinson's are hospitalized more often than people without Parkinson's. And many times what happens when people do go into the hospital that have Parkinson's, they're going in there not for a Parkinson's related event. All right. Like my sister. All right. I mean, it was a medication that she had taken and she had a side effect. Or somebody that's going in for a GI tract or a UTI or maybe some type of a shoulder replacement. So some hospitals, as I mentioned, are flagging people with Parkinson's, but most of them, even centers of excellence, it's not happening across the board yet. Next slide, please. So why does this happen? All right, why does it happen when people go into the hospital that have Parkinson's? Why don't they get their medications on time? And why don't they get the right medications? So there's an acronym here that we have, and it's called MODS, M-O-D-S. Okay, so it's missed, omitted, delayed, or substituted. So as we talked about initially, sometimes what happens when people with Parkinson's go into the hospital, they aren't flagged. And so that information is not even in the hospital record. The second reason is that the medications are omitted. Okay, so they're omitted usually erroneously. I mean, even if a person in the hospital is NPO, if they're preparing for a surgery, there are still different methods that people can get their levodopa. And if
What's
there's
NPO?
NPO, I'm sorry, it's not to feed by mouth. Thank you. Thank you. So so is that clear? Nothing by mouth, nothing by mouth. And then if there's a swallowing issue, that's another problem, that the medication may be withheld. However, if you withhold the medication, it's just going to exacerbate the swallowing problems for the person with Parkinson's. And I think that we all know that. The next one is that medications are delayed. Now, why are the medications delayed in the hospital? Has anyone here, I'm sure some of you have already been hospitalized, or you know somebody that's been in the hospital. Hospitals are on their own schedule. They're not on the schedule of the person going into the hospital that's taking their medications at a certain time. So what happens is during the hospital stay is that you have 3 shifts, the nurses come in from 7 to 3, 3 to 11, 11 to 7. And each time that the shifts change, um, what we need to do is to be able to educate the providers that come into our rooms about the times that we need our medications and how important it is to get those medications on time. And lastly, the substituted medications. What happens in the hospital is most hospitals run and they have a formulary. And in that formulary, they have a limited supply of medications. And usually they will not have your particular medication in the formulary. That's why it's really important that you have your medications with you in the original bottles when you go into the hospital. And the way that you do that is that we prepare a go kit, and we'll talk about preparing that go kit throughout this presentation. Next slide, please. So what happens, you can see like that what we call this is it's this symptom spiral. So you go into the hospital, you aren't flagged for Parkinson's, or you don't get your medications on time every time. And what happens is that your symptoms start to get worse. And on top of the symptoms getting worse, you have this lack of movement because you're in the hospital. You're not able to move, the exercise, and this all exacerbates, and your body gets out of balance really, really quickly. So what the Parkinson's Foundation has done with the hospital safety guide is we have identified the 5 Parkinson's care needs for people when they go into the hospital that need to be addressed. And in the guide, we're going to go through that right now, what the 5 needs are and how we can advocate for ourselves, or how we can have, if we have a family member or a colleague or a care advocate, help us advocate. But even if you don't have that, because my sister didn't have that originally, you can still, with this guide, advocate for yourself and protect yourself so that you can remain safe in the hospital and have a successful outcome. Now, from this point, I'd like to go ahead to a few slides for the other way, because we're going to talk. This is the hospital safety guide. I think that people have seen that, but we're going to go forward to slide 17. Keep going to the
Sorry,
time.
it's a little jerky.
That's okay. That's all right. That's fine. And this right here. Okay, thank you very much. So the 5 Parkinson's care needs. So the very first need that you can see, number 1, is that you need your hospital chart to include the exact medications and reflect the medications on your home schedule. So within the guide, you have a sheet where that you can write out your medications, your exact time that if you take at 3 o'clock, 6 o'clock, 9 o'clock, your levodopa, all the medications, the times that you take your medications, the dosage. And also what you want to do is to include any over-the-counter medications that you might be taking, stool softener or Metamucil, anything like that. And now what do you do with that? What you're going to do is that you're going to give that when you go into the hospital. It's going to be in your go kit. Now, in addition to that, make several copies, because what I recommend is that in the hospital, there's a reader board in each of the hospital patients' rooms. That is the communication tool in the hospital. Any healthcare provider that comes in the hospital room looks at that board first so that they can find out who saw the patient last, what's going on, what is the condition of the patient. Right there, you want to have that your list of your meds and that schedule right on the reader board so that everybody coming into the room can see that. That's extremely important. Next slide, please. And with the medication form, it's in the kit. You can also download it. And I think that we'll just, okay, one more slide, please. Thank you, Monique, perfect. So the way that the kit is set up is that it will have each of the hospital care needs. And then right after that, it's going to go ahead and give you how to explain your needs, and then what the challenges might be, and then the real-time steps. Now, the real-time steps, I'm getting questions here on the screen. Should I be addressing those right now, Monique?
If you want, it's up to you. If you
I
want to,
didn't,
if they're
I didn't
relevant to the,
see, I
you
didn't
can.
see the question, but I saw something float up with my name on it. We can ask questions while I go. I think that'd be a
Are you
great
talking
idea.
about a room post-admission or in the ER?
Oh, this would be post-admission. Post-admission in the hospital room. Thank you very much. So if you are admitted into the hospital, there's the reader board. But if you are in the ER, hopefully you have your Go kit. And we're going to talk about the Go kit that's going to have a 2-day supply of your medication in the original bottles, and is also going to have your medication list, your dosage chart, among a few other things that are really important with a doctor's letter. So what we're talking about right here is need number 1, and some of the tools that the kit is providing for you. So the medication form is 1. We're also talking about now a doctor's letter, and this is really one of the highlights of the kit. Now, the doctor's letter, I have it right here. I don't know, can you see this? Can they see this, Monique?
I mean, yeah, kind of. It's hard to see, but
Well, it's in the kit. So the doctor's letter is a letter that you can get signed by your neurologist. And in the doctor's letter, it's going over the 5 needs, and it explains exactly what the patient needs while they're in the hospital. The first need being is that in their chart that they should have their exact medication schedule as it is at home. The second need being is that they need their medications within a 15-minute window, 15 minutes before and 15 minutes after. Because most times what happens in the hospital is that the nurses have an hour window before and an hour window after, which is a really long time for people to wait for their medication. So this is the second need. The third need being, we're going to talk about contraindicated medications that you should not have. And then the fourth need is that we're going to be talking about being able to keep moving and exercise as soon as you can. And then the last need is about having a swallowing check while you're in there. So, okay, so
I
need
have
number
a quick
2.
question before we go forward, just in
Yes,
general about medications in the hospital.
yes.
Are you able to bring your own medications with you to the hospital and then have your partner or family member administer them? Or when you're in the hospital, do all the medications have to be administered by the nurses?
Generally, it's a hospital policy that you cannot administer your own medications. However, with the doctor's letter, what the doctor's letter is saying is that if the patient is able, the doctor is giving permission for the patient to go ahead and to have their care partner to administer the medications. However, if that is not the case, what happens is if you have your original bottles and your medication of your original bottles, you have a better chance of the formulary getting that for you outside of the hospital so that they can see what you're taking, as opposed to like my sister bringing her little pill pack, which didn't have any information on what kind of medication that it was. Good question. Is there another question right now about medication? This would be a good time to ask.
I
And
can't see
dosing?
the questions because I'm sharing my screen. Jen, are there any questions about medications specifically?
No.
Okay. All right, why don't we keep going? Should I forward the slide?
Yeah, sure. Need number 2. So the need number 2 is, well, the need number 2 is that you need your medications on time every time. And that's really no secret, because we all know what happens if we don't get our medications on time every time. Now, speaking about, we know what happens if we don't get them. You would think that all of the hospital personnel would know also, but that's not the case. When we go into the hospital, when a person with Parkinson's goes in the hospital, we have to assume that most people coming into your hospital room are not experts in Parkinson's. All right, because not everybody can be an expert in Parkinson's. So we are in the roles of being educators. We have to educate the people that are coming into our room. We have to teach them how it is that they can best help us. And one of the ways that we can do that is within the guide. There's another tool. It's called the Parkinson's Care Summary for Health Professionals. Within the guide, there's about 20 of these, and it's a tear out. The idea of this is that you leave the book on your bedside table. Anybody that comes into your room, all right, you can go ahead. It's like a Cliff's Note for Parkinson's, all right? You tear it out or they tear it out. On the very top, it's going to be tell people about what are some of the common symptoms of Parkinson's. Because if you don't get your medication on time every time, you may present as if you're having a stroke. All right, mask face, that you're not responding, you're not responsive, and that they may be going to treat you for stroke, and that is not the case. So what else is on here? It's the 5 needs, but what else is really important is the contraindicated medications on the back, because not everybody knows that you should not be taking this Compazine, Compazine. This is the one that my sister ended up taking. Pre-op and post-op, a lot of times people have nausea. They have nausea. So they're given some type of medication to treat the nausea. And it shows you right here the medications that are safe and the medications that are not safe. And that medication that my sister had, if she would have had this, it probably would have helped her a lot, because that medication is right on here, that they never should have given her that medication for the nausea. So this is a great tool. It's a great cheat sheet. And I mean, it's very effective too. So that's about the medications on time, every time, within the 15-minute window. And again, it's up to us to advocate for ourselves and to educate the people that are coming into our rooms, because they want to do a good job and they want us to have a successful outcome. However, sometimes they just don't know Parkinson's like we know Parkinson's. Next slide, please. So this is the real-time steps that we talked about, explaining the impact. Oh, speaking of that, on your medication form that you're going to have in your Go Kit and that you're going to have on the reader board. Another thing that you might want to do is that you write down on there, if you don't get your medications, what happens to you? Like, what are some of the symptoms, so that they know that your rigidity increases, or that your balance is compromised, or that you may appear as if that you're in a stupor. So those are some other tips that you might want to include on the medication list. Next slide, please. Okay, this is what we just talked about the contraindicated medications. That is so important. There's a whole list of them within the guide. And it seems like a no-brainer, right? That you don't want to go ahead and take medications that are going to interfere with your Parkinson's, make your Parkinson's worse. Because some of these medications are actually dopamine blockers. Some of these for the nausea, as a matter of fact. So that's really important, that you educate the people that are coming into your room. And anytime that you are, that one of the healthcare providers wants to give you a medication when you're in the hospital, it really behooves you to make sure and ask them, what is it? Are you sure that it's safe? And can you please refer to this? Now, one thing about our hotline, our helpline, is that if you, by any chance, if you don't have this with you, I've known that have been able to call the hotline, and that the hotline can go ahead and fax this or send a copy of this over to the hospital All right, so that the healthcare providers, the staff can see this if you don't have it. So this is really important to know. And our line is open Monday through Friday from 9 in the morning until 7 in the evening, Eastern Standard Time. So don't be in the hospital calling them on Saturday or Sunday. Next slide, please. The fourth need is about moving our body as soon as possible, to move your body as soon as possible. Because we know that when we are in the hospital, it's really important to stay moving so that we don't incur or acquire any kind of pressure sores for our constipation, to maintain our strength so that we can help to decrease the atrophy, all of these things. So requesting a PT, OT evaluation as soon as possible is always a good idea. And if that doesn't happen, if you're still waiting for that, there's still exercises that you can do while you're waiting in bed. And it's in the guide. We can do alphabet. Oh, I'm sure we've all done this. Alphabet with your arm, with your hand, with your feet. There's different things, different exercises just to keep our body moving. And to request to be sit up whenever we're at our meals, and to try to get out of bed. And if we're mobile at home, and if it's safe and we're not a fall risk, to be able to start to walk as soon as possible. Next slide, please. And it's all about communication and education. All right. We really have to put on our teacher hats when we go into the hospital, I think, and continue to be that kind of a squeaky wheel, but we have to be a nice squeaky wheel. And there's nothing wrong with reminding the nurse that it's almost time for a medication. And there's nothing wrong with requesting to see a PT or an OT, because it's so important for our recovery. Because the more that you are able to move and stay well and strong in the hospital, you'll have a more successful outcome, and you'll be able to hopefully go home sooner rather than later. And the last need that we wanted to communicate is about swallowing. And most of us know that that swallowing can be an issue with people with Parkinson's. And that's sometimes why that in the hospital, people, if the healthcare provider doesn't know that swallowing is sometimes an issue with Parkinson's, they may want to withhold that medication. So getting a swallowing check whenever you go into the hospital would be extremely important. Again, asking to be seated when you're having your meals so that we don't choke. You know how sometimes what happens is if when you choke and something goes down the wrong pipe, it goes down in the airway, that it could cause aspirated pneumonia. So we don't want that to happen. So, and the thing I was surprised about here about brushing your teeth before your meals as well as after the meals, because a lot of times the dental care, the oral hygiene in the hospital seems to be, I guess, lagging. And that helps to get the bacteria out of your mouth, of course, and helps to decrease the chances of that pneumonia. Can we go to the next slide, please? Thank you. So again, to communicate your needs, to tell the staff that you've had problems swallowing in the past, and to ask for some speech and language pathology consultation. To avoid the medication pauses that, again, if we stop the medication or delay our medication, it's just going to exacerbate the swallowing issues for us, and minimizing the risks, as well as taking your medications. If you take your medications with a straw, has anyone tried to do that and just tuck your chin a little bit? That really seems to decrease the chances of choking also. You may want to try that. So how do we prepare a go bag? Does anybody out there, do you have a go bag?
No,
You know what a go bag is?
no, I don't know. I don't know what is go back.
Well, what is a go bag? This is your safe, this is kind of like your survival kit when you go to the hospital. all right, for a planned or an unplanned admission. So with the Go Kit, what you want to do, you want to kind of think about, we're in earthquake territory, we're in fire territory. Hopefully everybody out there has some type of a go bag. So with Parkinson's, as I mentioned before, you're going to have your hospital safety guide with you, hopefully. And the go bag is what I'm going to have in my go bag. All right. First of all, I'm going to have pills in the original bottles. Okay. I'm going to have at least 2 days supply of pills that I'm taking. All right. 2 days supply. All right. And what happens when you go to your neurologist, I know that your pills, your medications change and the dosages change. So we need to be on top of that, and we need to change that as well. I'm also going to have my little pill cutter and crusher just in case, all right, that I need to do something, have it cut it in half. Also, what I'm going to take an extra pair of glasses, reading glasses, and put them in here. If I have hearing aids, I'm going to go ahead and put in hearing aid batteries in there with it. Also in here, again, I'm going to have my medication form. And on my medication form, I'm going to have my meds, the doses, the times of my home schedule, and I'm going to have any over-the-counter medications that I may be taking. All right. Metamucil, stool softener, vitamin C, anything like that. All right. I'm also going to have this doctor's letter that is signed. How do we do this? Couple ways. You have 2 of these letters in your guide. All right. You can send it, mail it, fax it to your neurologist for them to sign it. And then you make copies and hang on to it. One in your Go Kit, one in your file, maybe one with a friend of yours. Or you can download it. You can download it also on the Parkinson's Foundation website. And on here again, it addresses the 5 needs that, now, speaking of 5 needs, I'm questioning you guys now. Who remembers need number 1? What's the first need that we have to think about? Something about our chart. I'm giving you a clue. What's the first need? I need to hear something.
That he has Parkinson's.
Right, exactly. Thank you. Okay, very good. All right. Number 2, what's the second need? Having to do with medication.
List of medications and the dosages.
Good, good. And what about the time? As far as on time?
Oh, yeah. Well,
On
the
time,
times
every
and
time.
within
On time, every
15
time. Okay.
minutes.
Go ahead. How about?
Well, the times, but then should we say on there, the goal is that he gets them within 15 minutes of the prescribed time.
Perfect. It says this in the doctor's letter. This is what the doctor is requesting. This is what your neurologist is requesting from the hospital. Very good. Okay, somebody else. How about need number 3? What's need number 3? About getting the right or the wrong medications.
Contraindicated medication.
That's it. That's it. That's it. Thank you. You get the refrigerator tonight. Okay, the contraindicated medications. All right, no contraindicated medications. And how do you know? How do you know if they are? Right here, you have the patient care summary. And on the back, it has medications that you are safe to take and those to avoid. It also is a little cheat sheet about some of the symptoms of Parkinson's. Okay, and then we have 2 more needs. Need number 4 is?
Exercise.
That's right, to exercise, to move the body as soon as possible. And you don't be shy about asking for an OT or a PT consultation, absolutely. And then the 5th one, the last need is?
Enjoy yourself in the hospital. No, I'm joking.
Oh, what'd you say? Stay out of the hospital? They're right.
Oh, enjoy yourself while you're in the hospital.
Enjoy yourself while you're in the, well, hopefully if we do all this, then you recover quickly and you enjoy as much as you can being away from your home. But the last one is about swallowing, right?
Oh.
To get a swallowing evaluation. And yeah, so that's all going to be in the Go Kit. That's all going to be in here. And I also like I said, I like to put one of these, the Parkinson's Care Summary, all right, in here. So this goes along. Here's what I like to do. Okay. I like to have, see this kit, okay, the safety guide, there is so much information in here. And when you get yours, I encourage you right away just to go ahead and to look at it and start to fill out these forms. It's really, really important because you don't think you're going to go to the hospital. You don't think. But what happened? My husband was in ER just last couple weeks ago, okay, for a gastrointestinal kind of thing. You just don't think of it. So when you have this, and then you have your go kit, I just staple it right on here and just keep it all together. But where are you going to keep it? Where are we going to keep it? Are we going to put it like in the closet, like where you forget about it? Where's a good place that you could keep the go kit, that if you needed it, that you would be able to put your hands on it? Anybody, where do you think?
With the
Where?
meds. With the meds.
With your meds, okay. Where would you, where else would,
In your car?
maybe in your car, that's not bad. By the door, somewhere by the door, maybe. You know, my brother-in-law in Bend, all right, has Parkinson's, and he uses his as a shaving kit. Okay, when we had the Aware and Care kit, he used it as a shaving kit. Okay, another friend of mine, a girlfriend of mine, she used it by her makeup because she wouldn't go anywhere without her makeup bag. Okay, so whatever it is that is going to work, but you want to have it someplace where it's accessible, where you won't forget it, or somebody else, if the ambulance, you know, if the paramedics are coming in, that they know it's right there, that you can take it with you. All right, it's this is a lifesaver. It really is, because this is a tool that is going to help you to advocate for yourself. Because if you're tired and you can't really explain everything, you can, I went ahead and I marked mine with different colored, okay, up here, as far as that I can find what I need, that I find the letter, I find the contraindicated, that I find out why it's important for me to be evaluated for swallowing. Okay, and it's really a passport to home, I think, is what it's all about, to keep you safe and to advocate for yourself, because hospitals can be a scary place. Not everybody, not all of the healthcare providers in the hospital are experts about Parkinson's. They can't be. All right, they just can't be. So it's really our jobs, again, to be good teachers and to be good advocates and to be able to communicate our needs. We really need to practice communicating our needs. And I think that people with Parkinson's most times are pretty good at that. I think you're pretty good at being able to tell people what it is you need and how you're feeling. And I hope that that's the case. Now, how do you get this? As you can see, Monique has this up on the screen. You can call the Parkinson's Foundation. They will send it out to you. It's perfect. You can download the information. You know, I have a few here. I'm local. I'm in town. I could, you know, drop them off, maybe with your group, and not with later stage. I think it's time for maybe some, I'm trying to think. There was so much information. So a thing I want to review before we move on. Okay, Brain and Life. This is a free magazine. Okay, don't miss it. Your kit, I want you to be prepared, and I think that you know how to make a go kit, because the go kit, again, this is your medications that you're going to have in here. In your original bottles, a 2-day supply. All right, you're going to turn this over to the hospital, all right, to your care providers when you go there. Hopefully, then they will be able to dispense your medications to you. And then if they don't, or if they don't have it, they can call your neurologist, and then hopefully the neurologist will be involved so that we can make sure that you get your meds on time every time, so that you don't have any problems with your healing, so that you can get home as soon as possible. So this is just a review about the hospital safety guide, where you can get it, the 5 care needs that we've reviewed a few times. The step-by-step hospital planner is within the guide, so it's going to prepare you before you go into the hospital. It's going to also prepare you at discharge. All right, there are steps in there that's going to explain to you what you need, what you should ask, if you're going to have in-home care when you go home, if you're already have scheduled for PT or OT when you leave the hospital. it gives you a complete, it's a roadmap. You know, you remember like AAA used to have the triptych kind of thing. It's the same thing, you know, it's a roadmap so that you don't have to try to figure out what's the next step that I need to do here. Because the next steps are right there in front of you. You have lots of resources. And if all else fails, you can always call the helpline at the Parkinson's Foundation. I've called them many times to find movement disorder specialists or to ask a question if I was unsure about a medication. And they are wonderful. They have lots of experts there that can really help you. Prepare your go bag. So how many people are going to prepare their go bag by the end of this week? Okay, I see hands. Good. This is very important. Yeah, go bag, or if you don't have it, and you're going to update your go bag, right? You're going to update your go bag. All right, like every time you go to the neurologist, the medications change. I mean, it's good practice. It's really good practice. And the doctor's letter, that's easy to do because we have the portals now. You have the healthcare portals. So the doctors are pretty good at that. They get back to you really quickly. You can fax it, drop it off, mail it, but get that doctor's letter because that's going to have a lot of weight when you go into the hospital. Really, it's going to have a lot of weight that your neurologist is instructing the hospital that these are the directives that you should follow. So with all of that, it's a lot of information, but
we put the link to the
everybody's still awake. I see that.
We put the link to order your guide in the chat. So you can click on that and just do it right now if you want. There's also the phone number is in there as well. If you prefer to call, I don't know if you can get a guide by calling.
Yes,
but I did order my own guide and it's very, very simple. You can download it or you can actually send away for it and they can mail it. I think someone I saw had one. Was that you, Eileen, maybe?
Yeah. I
Yeah.
got this.
So you must have sent away for it and received it in the mail.
And you have, and you have the old, So even if you have this old, the Aware and Care kit, all right, you want to get this too, okay? Because this supplements it, and this hospital safety guide has some other features that this does not have. The tear sheets were so small in here, people had trouble reading them. All right, so there are certain things that this has that doesn't. So it's a great companion piece. Yeah, be fashionable, have both.
This has been wonderful. Thank you for all this wonderful information and giving us the access to this guide. One question I have is that it seems like the guide would be really perfect, you know, if you had a planned surgery and you could get all this prepared ahead of time and take it with you. But what about unplanned hospital visits? You know, what should someone do to prepare for an unplanned visit? Let's say you're just driving and you get into a car accident and you go to the ER. You know, you're not going to have your meds and your go bag and all that with you. Are there other things that you can do to be prepared for an unplanned visit?
Yeah, good question. Absolutely. First of all, one of the things in the guide, all right, in the back is the medical alert card. You have 2 medical alert cards right here. All right, so you need to, in the very back, you need to take one of these out, complete the card, and put it in your wallet. And you have a spare if you want to go ahead and give one, if you have a friend or a partner or somebody that you have signed up to help you out or advocate for you, should you not be able to advocate for yourself. So on the medical alert card, it also has on the back contraindicated medications. It's a little bit smaller to read, but it is still there. And also, it says that you're not intoxicated because even though you may want to be sometimes, you're not intoxicated because sometimes Parkinson's, when you don't take your meds, you could appear to be that way. So that's one thing. The other thing is to have some type of identification bracelet. All right. The old kits had one of these ID bracelets. Now, the new kit does not have this ID bracelet. Now, I have some of these. If Monique and Jen would like some, if you guys want some, all right, I could share some with you. However, you can also, does anyone out there have an ID bracelet or anything that identifies them as Parkinson's? Anybody in the Zoom rooms?
Yes, I do, but you can't read it. It's all scratched away, eh?
Oh, well, can't you read it at all? It says, oh, I see that. Yeah, I see that. I see it. So you can't see the Parkinson's? Well, you need a new one then. Everybody should have some type of an ID bracelet to identify them. That or something like a necklace. You need some type of identification. Also, I think that it's a good idea that that you would carry. I think most people with Parkinson's carry their medications. They may not carry them in the original bottles, but I think that it's a good idea that you carry your medication list. I think a lot of people do that also, that you, so I see some head shaking. A lot of people carry their medication list with them, carry the list and the dosage and the exact time. Also, what you want to carry with you is phone numbers. Okay, phone numbers and a hard copy. Like I said, your iPhones are great, except when they're not charged, except when you can't find it. So hard copy. People, your neurologist number, whoever it is. There you go. Perfect.
I have this in my phone. And
Mm-hmm.
I have a case for my phone, so this is in my phone.
Okay.
What
Okay.
does it say on it?
Says Susie Q's meds,
Nice.
and then I have
Well,
it.
is anybody else? I'm sure that you guys are a very creative group. Who else has some things that kind of prepared just in case you would have an unplanned? There you go. I see Susie Q's on it. Who else? Oh,
Well, but we've got a med list on the wall in the kitchen that,
good.
I can grab.
Okay. Who else? What?
My
I have a
husband,
med list.
I see Nalina.
Yeah, I have a bed list in this. But,
Okay.
file
All right.
corner.
Any, Debbie, anybody else have some ideas for us that you?
my husband and I carry a double-sided sheet in our wallets that lists all the contact information, our hospitalizations, our immunizations, our medications, our contraindications. And it's a godsend when you go to a doctor's office and they give you 2 lines to list all your medications. I just
Really,
hand
at
them the
this,
sheet and say, here you go, folks.
exactly, right. I know, I can relate. Yeah, at this stage of the game. Yeah, for sure.
Karen, did you create that yourself or did you follow a template that you?
I learned that from my mother. My mother was very proactive and she carried like a 5x7 card in her purse.
Mm-hmm.
Followed her lead and we update it regularly. And, I also have copies in my calendar, which I keep with me all the time. So I can pull that out at a moment's notice to show people. I keep the original. I said, make a copy for you. And something like that could go right in your records if you're in the hospital.
Did Debbie have a question, comment?
You need to unmute
You're
yourself.
muted, Debbie.
I think also Eileen had a question.
That's a question.
Yes, Eileen.
Am I
Debbie, go, Debbie.
am I unmuted?
No,
Yes.
you're good, Debbie. Go
okay.
ahead.
I have Kaiser, and there's something on the Kaiser site where I can actually download all of my, like I have many different conditions, and it'll actually cite all of those conditions. So I have a folder that I keep that. So if I have to call 911, it's available. But unfortunately, a lot of times they say, oh no, that's all right. Kaiser already has that. And, and my list of medications I also have. But when I took my medications to the ER, and I really needed to take them, at least they maybe let me take them for the first time. But after that, they wouldn't let me, even if I had more on hand.
Yeah.
They wouldn't let me take my own medication, even when we brought the bottles.
Could I share with you something that I shared recently with a group leader Round Table, which is with the PMD Alliance? This is a big topic of discussion, this whole business of hospital safety and getting pneumatic medications. My sister was a physician. She didn't have Parkinson's, but she was always afraid that if she gets to the hospital, that she would not be able to get her medications. So she had this bear. Now she died 30 years ago, but you may have seen one of these. But the beauty of this bear is that his head comes off and there's a vial inside. Well, this was a real hit with this group. And somebody found one on Etsy. It's called a nurse bear medicine bottle stash. So if you get really desperate, pull off your bear.
That's great.
Yeah. Thank you, Karen.
Mm.
I
Yes,
think Eileen,
Yes, Eileen.
Well, my partner is not able to self-advocate, not even close. And I know a lot of people with Parkinson's are not
Mhm.
able to. And I'm wondering if I'm his power of attorney for healthcare and finance, will that help him be able to bring me with him, or for me to be able to come in with him? Because I'm concerned about being kept
Yeah.
out.
I
And I'm his
understand that.
partner, but we're not married, so I'm a
No.
family member, but
No, I understand.
any
Yeah.
insights on that one?
You know what? I'm not a legal person. Maybe somebody else here has that information. But my sister, what happened with her actually, I'll tell you real quick. I think you'll like the story. Um, my sister was married for 43 years to the same man. You know, I'm from Pennsylvania, and we were raised, and she went from mommy and daddy's house to get married, and that's it. She had her kids. What happens is had Parkinson's, fully ambulatory, you know, she just, couldn't drive anymore because she had too much anxiety. So her husband, left her, found another gal, left her. So no, wait. So what happens is that this was during pandemic. So we're Zooming the divorce. I'm here in California. She's in Indiana. We moved her to Michigan. So we move her to Michigan, and she's in a 55 and over community. And here what happens is, after the divorce, though, she meets a fellow there. The fellow has a red Jeep. He has teeth and all of his hair. Okay, what a bonus. So now she has a boyfriend. She has a boyfriend, and it's like this happy, happy ending. But what happened when she was on the train, Randy, her boyfriend, we were at the hospital. He took her to the hospital. Well, the ambulance took her to the hospital. I went up there, and they would not allow him to whatever, to be involved. When I came on the scene as the sister, they allowed me. So I think that it would probably behoove you to get some information about that and be that person, Eileen, to be that person, to get that passport, whatever you need to be an advocate for your friend. Does anyone have any feedback or experience? Thank you.
Okay.
Debbie, do you have one more question?
oh, well, I just wanted to say I've had all of these experiences within the last 9 months with 2 emergency 911 trips
Oh,
to
my word.
the ER and also my local Kaiser hospital. And one of the things, when things went so bad regarding medications, and I have supraventricular tachycardia, and the nurses kept saying, well, you can only give you medicine at this time, and this time. And I said, if I don't take that by 8 o'clock in the morning, my heart goes really wacko, and then I'm really in trouble. And what I finally had to do is, when a doctor came to see me, I let them know how dangerous this was and what was needed and how I was being treated. And sometimes the nurses would come and sort of try to get me up, and they go, I'll be right back. And then an hour later, there still was not someone there. So the only way, at least I feel like I advocated for myself, is the doctor suggested that I talk with social services. And the 2 people that came up from social services, and they found out the junk that I had been going through and not being given my medication. They promised me that they would be meeting with the staff and making sure this did not happen to me again. And similar really bad things happened to me while I was in the ER. And finally, I would at least be able to talk to someone who had the power to go up and say, no, we're doing this with her and making sure that this happens. So it was really horrible, 2 experiences, but at least I found someone to actually listen and help to get things a little more fixed.
Thank you for sharing that. The social worker in the hospital. Yeah, very good. Thank you for reminding us about that, to reach out. Absolutely. Thank you. And you're a survivor too. I think all you guys are survivors.
Thank you.
I just wanted to mention that Debbie was fortunate to be able to advocate for herself But that's not the case. And I always worry about the people who cannot advocate for themselves and do not have a family member. Is there any mechanism for training or providing a patient advocate who can be there to do what Debbie did for herself?
Thank you. Good question. Well, the advocate piece is that at this point, hiring somebody, going to an agency and finding somebody that will be your advocate if needed. That's pretty much that is pretty much it. When you're in the hospital, talking to the social worker. So those are the two avenues at this point in time.
Aren't hospitals supposed to have patient advocates or ombuds people?
You know what? Aren't hospitals supposed to? Supposed to.
Yes.
Hospitals are supposed to give us our medications on time. Hospitals are supposed to do a lot of things. My experience has been with the social worker in the hospital. I don't know if all hospitals have advocates or ombudsmen. I don't think that they do, but I think it's a very good idea.
Well, and I think the beauty of this, of the hospital guide is to encourage people to be their own advocates. I mean, I think it's supposed to, it's sort of
Well,
guiding you.
that's true. However, just like Karen said, sometimes it's not possible. And that's why the planning is important. Planning is important. You have to figure out, do I have somebody that can go ahead and advocate for me if I can't advocate for myself at some period in time? And if not, to find an advocate that you would be able to hire a care advocate from senior services, like in Santa Cruz County. God, I can't think. Senior Resource Center, the Senior Resource Center there. If you call them, you can probably be connected with some type of an advocate that you can hire. Probably here in Oakland, likewise, calling the Area Agency on Aging or Senior Center, trying to find somebody. But yeah, it's tough. I totally agree. I mean, just think about during pandemic time, when people, even if you had an advocate, they couldn't go in the hospital and advocate for you anyway, right? During pandemic, all that time that people were not able to have an advocate. So the message here is prepare. Be prepared, think ahead as much as you can. Make sure that you get your hospital safety kit. Make sure that you make up your go bag. Please be sure that you get that doctor's letter signed by your neurologist as soon as possible. Your medications, carry them on you, carry the list like many people here have, and also the phone numbers of contacts. And stay out of the hospital if you can. Just stay out. Yeah. Stay well, stay strong. Stay well and stay strong. Keep moving. Moving target's hard to hit. Keep moving.
And I know you said, Helena, that it's better to have hard copies of things and not rely on your iPhone because
Well, not better. I think it's a good backup because if you don't have the iPhone, it's good to have the iPhone all set up. All right, it's totally great. Your watch, your iPhone. But I'm just saying what happened with my sister. They wheeled her back. Her boyfriend had her phone. The phone was dead. I mean,
yeah.
You need a backup plan. You need somebody waiting in the wings.
Well, there is, I don't know, for those of you who may not be familiar with it, there is the Apple has a sort of built-in health app on it, Medical ID, and you can program all that stuff into it. You can program that it says that you have Parkinson's and what medications you're on and when you need your medications. It has an emergency contact person that you can put in there. So if a first responder, finds your phone, they can access all that information without your password.
Oh, that's great.
And if you call from 911 from your phone, it'll automatically alert your contact person. So if you're interested in learning more about that, you can come to Tech Tips. And that's one of the big things that we'll be going over. I also think I saw on your website something about, oh yeah, here it is, using the medical ID on your phone. I'll go ahead and drop that in the chat. I think if you don't have that set up, I highly recommend that everybody get that set up on their phones.
Yeah, can't hurt.
All right, are there any other questions? You can go ahead and raise your hand or unmute yourself and ask. Okay, it looks like Debbie, you have another question?
Debbie in the lead.
I'm also legally blind, and I was wondering whether you would be able to provide some of that information in Braille or large print.
Debbie, thank you so much. I've not had that question yet, so thank you. I'll follow up on that because I don't know. But that is really an area that that we need to look at, that I need to explore. I will find out from the foundation tomorrow, and I can go ahead and email Monique. Thank you
Okay.
for bringing that up. And the large print, the print that we have in the kit, actually in the guide, I think it's probably like a 14 font.
Uh-huh.
Yeah, you need bigger than that. Yeah.
Right.
All right. Thank you. That's a really, really, really good point.
Is it available in other languages like Spanish or?
We have
Mandarin?
Spanish. We have Spanish. Yes, we do. Yeah, we have Spanish, and we had the Aware and Care Kit available in Spanish, and I think just in Spanish, or maybe I don't know. I don't know. It wasn't Chinese. I can't remember, but Spanish and English, yes. Spanish and English we have, and we're working on expanding, getting more languages, of course.
Yeah, I can see on the line you can order a lot of things in Spanish. That's nice.
Mm-hmm. Yeah. But thank you for that question, Debbie, because that has not
Okay.
come up, and I will bring that to the foundation and see what we have with that. 'Cause I know that a lot of our materials, a lot of our booklets, can also now be downloaded on the Kindle, and I don't know,
Uh-huh.
with Kindle, you can make it, I guess, bigger, right? But I don't know if you can do like an audio thing.
Yeah. But I mean, I can no longer type on the computer because of my Parkinson's.
Yeah.
But my husband is really good, and he can download things for me. I'm just not as good about doing these things since I don't type anymore. So
Mm-hmm. No, but that's really good. That's a good point. I'm so glad that you brought that up because that is not anything that was in my radar. So that's
okay, thank you.
that's a good one. Thank you. Yes, I see Susie Q.
What area are you from, Dr. Fox?
Oh, first of all, I'm not a doctor. I'm a gerontologist and a social worker. But I'm here in Oakland now. I'm in the Rockridge area. We were in Santa Cruz for the last 23 years, originally from Pittsburgh, Pennsylvania.
Yeah.
Anything else? I'd like to thank all of you for spending some of the evening with me tonight. And I look forward to seeing you again at one of the PD active events or in the neighborhood or wherever. And please, again, I'm reminding you, be sure that you take action. All right. Don't rest on your laurels, take action, get your guide, get the doctor to sign your list, prepare your go kit, and yeah, advocate for yourself and stay safe, stay well. That's it.
Thank you.
Thank you,
Okay,
Helena.
thanks, everybody.
Thank
Take
you.
care. Have a
Cheerio.
good rest of the week.
Thank you, Monique and Jen.
Thank you.
Cheerio.
Appreciate you guys showing up. Look for the link to the recording. Bye.